Thanks for listening to the FUCancer podcast. My name is Christina Rollins. I'm a dietitian, mom, and wife to a pretty awesome cancer survivor. We said FU to cancer nearly 25 years ago and are still going strong. I'm excited to share the FUCancer movement, where we are a community of survivors, fighters, caregivers, and advocates, connecting our shared experiences, passion, and determination to live a holistic and well-balanced life. Stay tuned, because we've got a lot to talk about. Hey everyone, welcome back to the FUCancer podcast. Today's episode focuses two critical but often overlooked aspects of recovery: nutrition for cancer survivors and lymphedema management. Joining me is Jean LaMantia, a registered dietitian, cancer survivor, and author of multiple books on using food as medicine during and after cancer treatment. Jean is also the creator of Lymphedema Nutrition School, where she supports both patients and healthcare professionals in understanding how nutrition can reduce inflammation and support lymphatic health. So, Jean, thank you so much for joining us today at FUCancer.
Oh, thanks for inviting me.
So, I'd love to kick off this episode by hearing about your own cancer journey and how it led you to specialize in nutrition for survivors and those with lymphedema.
Yeah, so my own cancer journey started when I was 27. So I was already a dietitian at that point. I'd done my degree and my clinical internship. I'd had a first job working on a neurology unit in a hospital. I loved it, calculating tube feeds. I thought I'd always be working in inpatient in some critical care area. And that was a contract. And then I worked at as a diabetes education center after that, another contract. And then I noticed this stiff neck, and it just wasn't getting any better. And I worked with a bunch of nurses, and they're like, Jean, you got to go to the doctor. You know, those nurses, they don't let you get away with anything. Like, oh, you've been complaining about the same stiff neck. And the one thing I could tell them that was different when I went to the doctors, if I had alcohol, the pain in my stiff neck would radiate down my arm into my hand, and it would be tingly and numb and painful. And I'm like, what is this? But I mentioned that to the doctors, like, that makes no sense whatsoever. And I think that was around September, October. And then that contract finished, and I went traveling. I had a real wanderlust, and I went to Mexico, and I lived with the family, and I did Spanish immersion. I traveled through Central America, and I was tired, but my host family kept saying, "Ah, all the students that come here are tired. It's the altitude." So I'm like, okay. Um, but when I got back, I just happened to notice a blood donor clinic. So I'm like, okay, I've been a blood donor before. I'll give some blood. Well, I just started to get really sick.
Mhm.
And what I think happened, and eventually that led me to getting diagnosed with lymphoma, which is lymph node cancer.
Mhm.
So the lymph nodes in my neck, under both arms, and in the middle of my chest. I had a 15 centimeter tumor in the middle of my chest.
Mhm.
Um, that was my lymphoma. And just, I'll say as an aside, I did call the blood bank back and say not to use my blood because they suspected I had something.
Mhm.
Um, and, going through cancer treatment, that seems to be a lot of focus for nutrition. When you learn about oncology nutrition, it's managing the side effects of cancer treatment and dealing with, all the things that come up for people like mouth sores and taste changes, nausea, vomiting, diarrhea, reflux. Like I had a lot of those things on the list, and that's definitely important. But what I found, there was like this switch after treatment was done where you've been sort of taken through the whole process, and your oncologist and the nursing team and the pharmacist and everyone's like, oh, come, come, like, let's hold your hand through the treatment. And then when you've had your last treatment, see you later. And you just feel like, oh my God, now what? And I remember asking my doctor, like, what should I do? Because the thing that most cancer survivors are afraid of is cancer recurrence, right? And I was definitely in that boat. And he said, oh, just eat a healthy diet. And I thought, that that doesn't seem like enough. Like, that just doesn't seem like enough. And so I lived with a lot of anxiety at that point. Like every little twitch in my body, every little headache was like, oh my God, it's the cancer. It's back. And I was just hyper vigilant. I was just a nervous wreck, is what I was. And so finally I had to like, Jean, like I had the come to Jesus moment, where it's like, Jean, you have got to get a grip. Like you're out of control.
Mhm.
So, I started using the skills that I had, in my training to become a dietitian, just started reading as much as I could about cancer nutrition and realizing that things kind of fit into one of three categories when it came to survivorship. It was either to eat to support your immune system, because the immune system, it can take care of these rogue cancer cells in the body, or it was about reducing inflammation because inflammation creates this environment in the body that cancer cells do very well with.
Mhm.
And the third one was from a lot of the laboratory research where the scientists are working with cancer cells in a petri dish and introducing extract of ginger or garlic or cabbage or green tea and seeing that, oh, well, it damages these cancer cells. So these nutraceuticals were important. So I actually ended up creating nutrition guide. If you like, I can show you for cancer survivors. And so it's called the Cancer Risk Reduction Guide. Whoops.
Mhm. There it is.
And it talks about nutrition for those three key components, right?
Uh-huh.
Um, Reducing inflammation, supporting the immune system, and eating nutraceuticals. So then it just seemed like everything else I read after that was like, yeah, that's part of this, and it's so important. And I love now working with those clients that just have a million questions. They've been doing some reading or they're hearing contradictory things and they just want to know, like, what's my opinion? And I just love nerding out on all the research. Like, I'm such a geek. Like, I just love going, okay, well, I read this study and it showed this and this. And I love, really digging into all that stuff. So it's definitely my wheelhouse, as it turns out. Not what I thought early in my career.
Mhm.
Um, so yeah, that's what brought me to working with cancer survivors.
Well, I love that you took such a traumatic experience in your life and you made it into something so positive. And I will say my husband he's a 25 plus year cancer survivor.
Mm.
He had stage 3 testicular cancer that had mets to his lymph nodes too.
Oh, wow.
And it was horrible. And you're right. I mean, for years, he had a headache. It's like, could be brain cancer. Is it
Right.
metastasized? His leg hurt. Is it bone cancer? And you constantly have that worry that any little thing could be a recurrence, and it's terrifying. So the fact
Yeah.
that you took that and you harnessed it into something positive, I think is just amazing.
Yeah. It's almost sort of necessity too, it's like I couldn't keep living like that. Just
Yeah.
wasn't healthy.
Yeah. So, what are the most common nutrition mistakes that you see among cancer survivors?
Um, I feel like so mistakes o- well, one area I would say that's maybe I wouldn't necessarily call it a mistake, but where they get into things that are maybe not evidence-based and they end up restricting their diet more than the
Mhm.
evidence supports,
Mhm.
or they're generating a lot of fear about certain foods that, again, the evidence doesn't support. So dairy, for example, is one of them. A lot of clients I work with are just so afraid of dairy products.
Mhm.
And um, I do share with them the research. A couple of great sites are the World Cancer Research Fund, so the WCRF, the American Institute for Cancer Research, the AICR. And, I really like the way they collate all the data around nutrition and cancer. And I'll share with my clients, the evidence around that, not to convince them that they have to put dairy back in their diet, because if they don't want dairy, that's fine. But I just want them to release some of the fear, or
Mhm.
if they happen to be out and, they're at someone's house and I don't know, there's a little bit of Parmesan cheese or something, they don't have to, have this fight or flight reaction or feel like they're totally harming themselves, right?
Mhm.
Um, so that's one thing where I see people tend to um, get maybe a incorrect information.
Mhm.
Another one would be around seed oils. You
Mhm.
see this, it's all over social media
Really
now.
popular
How
right now.
seed oils are
Yeah.
inflammatory and you're a lunatic if you're eating seed oils. But again, if you look at the studies, like clinical trials and big epi studies, it doesn't support that. It shows that the monounsaturated fats, the polyunsaturated fats, which come from seed oils, are anti-inflammatory. And we know that reducing inflammation is a big part of, um, changing the environment inside your body to make it less hospitable to cancer cells. So that's another one. So I like to do education around the evidence around that too. Yeah.
So I want to circle back to lymphedema in particular. And what's the connection between dietary intake and lymphedema and sort of your overall lymphatic function?
Right. So let me just back up a little bit and explain what is lymphedema for your listeners who don't know. And probably a good example is to take a breast cancer patient as an example. Um, or even your husband's case that you mentioned, like having testicular cancer that metastasized to the lymph nodes, right? Um, but we'll stick with the breast cancer example. So if a woman has been diagnosed with breast cancer, a lot of times that involves a surgery. And the
Mhm.
surgery might be a lumpectomy, it might be a mastectomy. And in that, they might remove some lymph nodes from the armpit. And there's two ways to do that. One is called a lymph node dissection. So that's basically a total judgment call on the part of the surgeon. So they'll be looking at the scans and all the information they've done to stage the cancer. But really, it just comes down to how things look during that surgery, and they decide which lymph nodes to take out and how many. And with the goal in mind being, we want to get rid of this person's
Mhm.
cancer and we don't want it coming back again. So they tend to take, you know, uh, a few.
Mhm.
Sometimes they clear it out. Kind of really, it's the judgment call of the
Mhm.
surgeon. The other process is called a sentinel node biopsy. And in the case of the armpit, it's an axillary, axilla meaning the armpit.
Mhm.
So in that case, a dye is injected near the tumor, and then it's allowed to circulate. And then during the surgery, the surgeon can visualize that dye and where it goes and which lymph
Mhm.
nodes pick up that dye. And those one or two or three nodes are removed. But however many lymph nodes are removed, the more lymph nodes that are removed, the greater the risk of developing lymphedema. Also, if there's radiation, that increases the risk. If there's chemotherapy, that increases the risk. If there's infection, that really increases the risk. If there's inflammation, if
Mhm.
there's any kind of injury to the arm, even if something like a sunburn, a mosquito bite, a blister, a scratch, like little minor things even, because what those do is they send out a call. It's like
Mhm.
cellular 911. Hey, I've got a cut, I've got a burn. Send the immune cells. Well, here they come. Here
Mhm.
come the white blood cells. And how do they get there? Through the lymphatic system. And
Mhm.
once they get there, they multiply, they have to deal with the injury, and then they try and leave, and bridge is out because we've got all the scar tissue and missing lymph nodes here. And then that arm is then swollen.
Mhm.
And that is lymphedema. So edema is any kind of a swelling, right? A fluid retention swelling. Lymphedema is a swelling of lymphatic fluid. And lymphatic fluid is unique in that it is a protein-rich fluid.
Mhm.
So that's lymphedema. Now, how does dietary intake affect that? In a number of ways. So, for example, if you have a lot of salt in your diet, that can make your lymphedema swelling worse.
Mhm.
Um, if you have a lot of fat in your diet, your intestines um, absorb fat from your diet. But fat, whether that's mayonnaise or salad dressing or avocado or, you know, fat on a steak or coconut oil or whatever,
Mm-hmm.
once it gets into the intestines, the body breaks that fat down into different fatty acids. Now, some of those fatty acids are short chain, and a fatty acid is just a chain of carbons with
Mm-hmm.
hydrogens attached, and they have different endings. So some of those carbon chains are short, which means there's 6 carbons in the chain or less. Some are medium, they have 12 carbons or less, and some are long, more than 12.
Mm-hmm.
And if they're short or medium chain fatty acids, they get absorbed directly from the small intestine into the portal vein. Now they're absorbed by the body.
Mm-hmm.
Long chain fatty acids are not soluble enough to be absorbed there. So from the intestines, from the villi, they go into the villi and they go into a lacteal, which is a lymphatic capillary. And then those lacteals are all connected with connecting lymphatics. That goes all through this network of lymph nodes in the mesentery. And that's the lining that holds the small intestine to the abdominal wall, all the way up the central lymphatics, all the way up to the thoracic ducts, which are, if you raise your shoulders, it's behind your collarbones. That's where your thoracic ducts are. So fat from your diet has to come all the way up your lymphatics
Mm-hmm.
to this area in your neck to enter into the bloodstream. So the amount of fat, the type of fat that you eat, that definitely affects your lymphedema. Um, the amount of water that you drink. And this one is a bit counterintuitive. And I don't know, do you remember, Christina, ever getting, and I'm not sure what area you've worked in your dietetics career, ever getting a diet order for like a 1500 ml fluid
Oh,
restriction?
absolutely. Yeah, all the
Yeah.
time.
Yeah,
All
I
the
used to
time.
get those too when I worked in home care. So someone with heart failure, and they'd send
Mm-hmm.
them home on a 2-gram sodium diet and a 1.5-liter fluid restriction, something like
Yeah.
that, right?
Yeah.
So they have to be very careful. Take little sips of water to swallow their pills and
Yeah.
keep track of how much water they're drinking. And that's because their body tended to accumulate fluid, and we wanted to restrict how much they were drinking to lessen that burden on the heart and the kidneys. Well, with lymphedema, you don't do that. In fact, you do the opposite because lymphedema is a protein-rich fluid. So if I've got lymphedema in my arm, I've got a buildup of protein-rich fluid in here. And the treatment for lymphedema, it's called complete decongestive therapy. And it has
Mm-hmm.
4 components, which are skin care. So you want to keep the skin soft, right? You want to keep it well moisturized. Exercise,
Mm-hmm.
manual lymphatic drainage, which is a type of skin stretch. Like
Mm-hmm.
you could think of it as massage, but it's manual lymphatic drainage. And then compression. You might see people wearing compression sleeves or things like that. All of those 4 things are designed to help move that fluid out of the area. But if you become dehydrated, the protein in there becomes more concentrated and it's harder to move that out.
Mm-hmm.
And then the protein that is there, it's like a beacon. It sends out a signal to the body to attract macrophages and other immune cells. And once they get there, creates inflammation.
Mm-hmm.
And what that inflammation does, it says to the body, okay, let's start creating a fibrotic, fatty scaffold under the skin and let's start thickening this skin.
Mm-hmm.
And over time, people who have lymphedema, they'll notice changes in their skin, starts to thicken. Sometimes it gets all this warty overgrowth and you get this hard tissue underneath, so the fibrotic tissue under the skin. So we want to avoid that. So lots of water to keep that ability to move that protein out, right? So it doesn't get too concentrated. Anti-inflammatory diet. So those are some of the strategies that I've been implementing with the students and clients that I work with, and it's really helping.
Well, I'm glad you brought up the anti-inflammatory diet component
Mhm.
because I think we hear that thrown around a lot in the media, right? Like it's a
Yeah,
nutrition buzzword, it gets your attention. But what does
right.
that look like in real life when a cancer survivor is making their day-to-day food choices?
Yeah. So you're right, there's a lot of misinformation out there. But then I mentioned earlier about the seed oils, and that's one thing that often gets tied up in that. But if we go back to 2009, there was an important study that was published. It was the launch of a tool called the DII, which stands for the Dietary Inflammatory Index.
Mhm.
And the way this study was done, it was uh, basically a big meta-analysis. So they collected all research that measured inflammation in the blood. So these would be things like your CRP, which stands for C-reactive protein, your HSCRP, which is your high sensitivity CRP, C-reactive protein, your tumor necrosis factor alpha, your interleukins like interleukin 6, interleukin 10. So those are all measures of inflammation. And they looked at different food components and how those food components either raise or lower those blood levels of inflammation.
Mhm.
And then they ranked all these things. So some were very strongly anti-inflammatory, and some were, sort of weak, and then some were weakly inflammatory, and some were strong inflammatory. And then we came up with this index, and that's been validated. So since 2009, it's been validated in many studies, and then it was refined again in 2015. So we have quite a bit of data showing, first of all, that yeah, your food uh, can affect your blood levels of inflammation. Now, what where it gets a little jumbled up is like what actually that data says. And so one of the strongest anti-inflammatories is omega-3 fatty acid.
Mhm.
And I think that message comes through pretty consistently. So that's a lot of people think of salmon, right? Salmon, sardines, herring, mackerel, rainbow trout, anchovies. So your omega-3 rich fish, as well
Mhm.
as, some plant sources of omega-3 like, ground flaxseed and walnuts.
Mhm.
Um, Surprisingly, though, that research also shows that omega-6 is anti-inflammatory. That sort of gets lost because that's where you get a lot of this misinformation about seed oils and
Mhm.
avoiding it. But that data actually shows it's anti-inflammatory. Herbs and spices are very anti-inflammatory. The one, dietary pattern that has been consistently shown to be a good example of anti-inflammatory is that traditional Mediterranean diet,
Mhm.
that came about, back in the late 60s, early 70s during the seven countries study.
Mhm.
So that's a good pattern to look at. So lots of fruits and vegetables. Um, if there's grains in the diet, they're whole grains. Um, Lots of herbs and spices. If you think, living on the island of Crete in the 70s, probably, your grandma had a kitchen garden, and you got
Mhm.
fresh fish from the Mediterranean Sea. You had, thyme and oregano and basil and rosemary growing in your backyard. You had olives and olive oil and not much red meat. Like that was more for special occasions. You had fresh fruits, fresh vegetables. That's a good picture to have in mind for the anti-inflammatory diet.
Well, something else that you've written about is intermittent fasting. So,
hmm
how can intermittent fasting benefit individuals either living with cancer or recovering from it?
hmm So with cancer, there's two studies that I like to share, and one is a group of breast cancer survivors in the US, and they were followed in this observational trial to look at the risk of recurrence of their breast cancer. And what the researchers found was that if they fasted at least 13 hours every night, they had a lower risk of recurrence than those who didn't. And the interesting thing about breast cancer is it's what's known as a shift worker cancer. So it's common in nurses or flight attendants, right?
Mhm.
So workers who don't get that normal um, melatonin release, when they fall asleep at nighttime. Instead, they're trying to sleep during the day sometimes if they've had a night shift. Um, but it talks about, you can develop a metabolic jet lag or a social jet lag when your master clock in your brain, which is called your suprachiasmatic nucleus, it's the one
Mhm.
that detects light and darkness. And when it detects daylight, it starts a 24-hour cycle of different hormones and enzymes, etc. And if that's out of sync with your peripheral clocks, which are in your stomach and your digestive system, you can develop something called metabolic jet lag. So having that, decent, 13-hour overnight fast is good. Similarly, there was a study done in Spain looking at women who'd had breast cancer and men who'd had prostate cancer. Now, if you've ever been to Spain, you might know they typically they eat their dinner very late at night.
Hmm.
Um, it's one thing about the culture there that's sort of well known. And this study found that if they ate their evening meal, their dinner, by 9 p.m. instead of 10 p.m., and if they had at least 2 hours between the time they finished the meal and they went to bed, that they had a lower risk of recurrence. So intermittent fasting in survivorship, I think definitely has a role to play, as well as just having a good day and night schedule, not eating at nighttime when it's late. Even if you had, let's say an 8 hour eating window, it's really best to eat during the daytime and be
Hmm.
fasting overnight.
Well, you've given us a lot of great tips, and I really appreciate you sharing your expertise with us on this episode. So, if you had to pick just one change that a listener could make today to support their health during survivorship, what would it be?
Well, obviously fasting 13 hours overnight, I think would be good. What else do I want to share about that? And an anti-inflammatory diet would be good. Okay, I'll give you one thing, which we're recording this right now in the spring, so I think it's very timely spring conversation. And I would say use lots of herbs and spices.
Mhm.
So plant an herb garden if you haven't done it already. Use dried herbs, use fresh herbs, but they're very anti-inflammatory. And so that would be my tip for your listeners.
Wonderful. Well, we just have a couple of minutes left, but I would be remiss if I didn't ask. Tell us about Lymphedema Nutrition School and how our listeners can get involved.
I love Lymphedema Nutrition School. So it's my online group program.
Mhm.
So people who have lymphedema. Now, they might be cancer survivors, they might not be. Some people have lymphedema, they were just born with it. That's
Mhm.
primary lymphedema. Some have it because they were in a motor vehicle accident or had a sport injury. But a lot of people have it because of their cancer treatment. So all are welcome. And we meet for an hour and a half over Zoom for 10 weeks. So each week is a new topic, a new opportunity to set goals and to see how diet and nutrition can reduce the lymphedema. So one goal I have is, let's get your lymphedema down. Let's get that swelling down, the achiness, the heaviness. Let's reduce that. And the second goal I have for people is to get to know their lymphedema. Because a lot of people have it, they don't really notice the day-to-day fluctuations or pay attention or bring in any awareness to, oh, why is it more swollen today or what's going on today? And when you do bring some awareness to it, you do find, certain triggers maybe or certain factors may affect you more than other people. So it's also about getting to know your lymphedema and how it responds to different things and what sort of countermeasures that you can put in place to help it. And it's so important because lymphedema is a chronic condition. There's no cure. I mean, there are surgeries that some people are doing, but it's really not widely available and, still might not be considered a cure. But it's about day-to-day management of lymphedema. If you can incorporate some nutrition strategies, it's going to help so much. Yeah.
Wonderful. Well, that is so great. Thank you. And I know you've got the school, you have books, blogs, so many wonderful things available. Where can our listeners find out more information?
Yeah, thank you. Probably the best place to go is just my website. I have a shop there. You can see my books. I have a cancer book, intermittent fasting book, one on lymphedema, and another one coming out in the fall of 2025 on complementary therapies for lymphedema. And my website is my name. So it's jeanlamantia.com. And Jean is Jean. Lamantia is Lamantia. So jeanlamantia.com.
Wonderful. Well, thank you again so much for being here with us tonight. It's been wonderful to talk with you. I really appreciate everything that you're doing for the cancer care community. So thank you.
You're welcome, Christina. Thanks for the invitation.
And listeners, as always, we invite you to check out our website at FUCancer.health. We have a library of education available that's been curated for you by our cancer care experts. Until next time, I'm Christina Rollins. Thanks so much for listening.